Okay, let's talk about testing from home. It's a bummer to get sick in general, but you have to ask yourself this one question. If you believe you may have COVID, would you rather go to a doctor's office, wait in line with other sick patients? If you think one of your kids has COVID, do you want to take them to a clinic and sit in the lobby with a whole bunch of other sick patients so that the doctor can scrub a swab in their nose, scare the heck out of them, or would you rather just do it from home? I would rather do it from home, so I buy these iHealth COVID-19 Antigen Rapid at-home tests. I have multiples of them. I keep them around my house. I have used them personally myself, and I have also used other products from this company, iHealth, that I would absolutely recommend. But today, let's talk about the at-home COVID-19 test. People, for some reason, seem to think this is very difficult, and when you look at their directions, it may seem a little bit overwhelming, but it's super simple. I'm going to simplify it for you, and also, if you don't want to use this video as a guide, you can just scan the QR code to go to their website and watch their video tutorials. But each package is going to come with 2 tests, and when you open it up, it's going to have the actual test card like a pregnancy test kit, same type of deal. Then it's going to come with a vial and a separate container of liquid and also a swab. So the first thing you'll do is open the vial with the separate container, open up that little plastic container and pour the liquid into the vial and close it back up. This is going to be where we're going to stick our Q-tip in to put all of your nasal swabs into the liquid. So that's step 1. Step 2 is to open up the swab and make sure you don't touch the swab end or you can contaminate it with your fingers. Make sure you touch the other end. You're going to stick it in your right nostril and go around about 5 times, and you don't need to jam this thing into your brain. Just get it up in there to make sure you're getting a good test. Take it out, put it in your left nostril for about 5 seconds. Then you're going to take this container now that it's full of the liquid that was in here, and you're going to tamp it down like this to make sure all the liquid is at the bottom so that when you open up the top, none of it's going to spill out. Then you take your swab, stick it down in that liquid, and stir it around about 15 times. So about 15-20 seconds, stir it around. Now this is important. When you pull it back out, a lot of that liquid might stay inside of that swab. So if you squeeze the container tightly, as you're pulling that swab out, it's going to wring out a lot of the liquid that's in that swab and keep it in this container. Then you're going to take that liquid and you're going to put it into the test strip. You're just going to drop 3 little drops onto the test strip, the round part, and then you're going to wait for 15 minutes. Don't worry about the results until 15 minutes, and then anything over 30 minutes is too long. So you have 15 minutes to wait, and then you have 15 minutes to measure it. After that, it's too long. Before that, it's too soon. Got it? And there's a control line, which is a C. If that C shows up, that means the control is working. That means that test strip is quality and it's working. And then if a second line shows up, the T line, that means you are COVID positive, and you may then want to move on to the next step, which might be seeing your doctor. But it really does save you time to just test it yourself. And then if you are positive, then you can move on to the next steps. But please don't be overwhelmed by these type of kits. They seem kind of difficult, but they're really not. Once you do it one time, it's very easy. There's clear directions here for you. There's online tutorials, and now this video, it should help you, I hope. So there you go. If you are looking for at-home COVID tests, I would definitely recommend these.